A group of patients are given an experimental vaccine for Vibrio cholerae, which is taken orally. In a follow-up a year later, it is found that several patients over the age of 70 still had at least one episode of Vibrio infection. Which of the following is the most likely explanation for this finding? Choice A, increased likelihood of comorbid conditions. Choice B, decreased levels of IL-2. Choice C, decreased levels of immunoglobulin pentamer. Choice D, decreased levels of mucosal immunoglobulin. Choice E, decreased levels of immunoglobulin found on mast cells. I'll wait 5 seconds and then answer the question. So these patients are given an oral vaccine, and for whatever reason, it seems like it didn't work. So if you look at the answer choices, this is an immunology question. And what it's really asking you is, what is the main constituent of mucosal immunity, or immunity in the GI tract, which is IgA. So that's why choice D, decreased level of mucosal immunoglobulin, is the correct answer. The first thing you want to know here is that we're talking about elderly patients, and USMLE has tested this before. You need to know that immunosenescence occurs with aging, which is to say, when you're older, your immune system gets weaker. I'm pretty sure for a lot of you didn't even need to go to medical school to know that. But there's straight up MBME questions that ask stuff like that. So I decided to just add a layer of immunology to that sort of question where, well, yeah, you need to know that if an oral vaccine is taken, or anything in the GI tract, a big part of it is about your mucosal immunity, which almost always involves IgA. So looking at the other answer choices here, choice A, increased likelihood of comorbid conditions. I mean, yes, if you're elderly, you can have comorbid conditions and that could predispose to infection, but that's not really what the question is asking, so wrong answer. Choice B, decreased levels of IL-2. You need to know that IL-2 is strongly related to T cell proliferation. For the purposes of this question, it's unrelated, right? Because T cells have to do with cell-mediated immunity. So this would be more appropriate if we were talking about some kind of cell-mediated immunity deficiency. So maybe like HIV, chronic mucocutaneous candidiasis is one that comes up sometimes. The George syndrome is one that comes up fairly often. Just anything to do with T cells. Choice C, decreased levels of immunoglobulin pentamer. This is referring to IgM. IgM is the only immunoglobulin that forms a pentamer. So IgM is mostly serum-based, so obviously that's not really related to this question. You can also know that IgM is typically the first immunoglobulin to be elevated when you have an acute infection. Usually it's IgM first, and then you get IgG later. This can be relevant for a lot of questions where they're asking you about acute versus chronic infections or active versus inactive infections. So it can come up, for example, on like hepatitis questions, right? Choice E, decreased levels of immunoglobulin found on mast cells. Obviously, this is talking about IgE, which is mostly something you think about when you're thinking about type 1 hypersensitivity. Binds to mast cells, basophils, crossing by antigen, causes histamine release. Like I said, type 1 hypersensitivity, anaphylaxis, that sort of thing, can be related to helminth infections as well. Anyway, your takeaway from this question is not only do you want to remember immunosenescence, elderly people have weaker immune systems, and also know that if you have something to do with the gut and they ask you some kind of immunology question, you want to start thinking IgA. Not much else to say here. I hope you found this video helpful. I'll see you in the next one.